Monkeypox has been declared a public health emergency of international concern by the World Health Organization on Saturday, prompting an international coordinated response by member countries. Though Trinidad and Tobago has not recorded a case of the disease on our shores, Minister of Health Terrence Deyalsingh assured that this country is prepared. The minister noted there is no need for any rollback of public health measures at this time.
The current transmission of this monkeypox is very close skin-to-skin contact. So masking and so on has limited application, but we still advise people to mask. What people have to avoid is that close skin-to-skin contact, especially with someone who has recently returned from one of those 70 countries. So the transmission of both viruses are significantly different. So the public health response is also going to be different.
This country is in Group 1, which means it has no history of monkeypox, no cases for 21 days, and must comply with 9 action items, of which Minister Deyalsingh said majority have been fully met. This includes the training of healthcare workers, assigning facilities, and public education. Minister Deyalsingh also gave an update on the procurement of the monkeypox vaccines, noting there have been challenges.
We are pressing our partners even harder for Trinidad and Tobago to get vaccines, which are now being hoarded again by countries that are now stockpiling vaccines far in excess of their needs, the same way they did it for COVID, which is regrettable. And this is an issue I've been raising for the past 3 weeks or so, that we must not repeat the errors of vaccine hoarding.
Minister Deyalsingh noted that testing capacity has been acquired at the Trinidad Public Health Lab, and the ministry's public education campaign on monkeypox will be ramped up. And Trinidad and Tobago has recorded 1 additional COVID-19 related death in the last 24 hours. According to the Ministry of Health's daily clinical update, an elderly man with multiple comorbidities is the latest fatality. The total number of deaths due to the virus is 4,042. Additionally, 133 persons have tested positive for the virus. This brings the total number of active cases to 6,109. The ministry advised that these new active cases were from samples taken from July 21st to July 22nd and not in the last 24 hours. 105 persons are receiving treatment at hospital.